Good afternoon, everyone. Thank you for joining us today for our webinar on integrated service delivery. We will get started with this webinar. Before we get started, we are going to go through some housekeeping tips. My name is Michael Rausch, and I'm with the National Disability Institute. And my colleague, Nakia Matthews, is going to go over our housekeeping tips before we get started. Nakia?
Thank you, Michael. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see below. And if you accidentally close this panel or if the sound becomes unintelligible or stops, you can reopen the audio broadcast panel by going to the top menu, Communicate, and clicking Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial the number you see here and enter the meeting code, and you do not need to enter an attendee ID. And I will put this number and code in the chat box so that anyone can have it. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which is in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize some of the other panels like panelists, chat, Q&A. And conversely, if you want to make the media viewer smaller, if you don't need it, you can minimize it. There will be a question and answer session at the end of the webinar. Please use the chat box or the Q&A box to send any questions you have during the webinar to Michael Rausch or myself, Nakia Matthews, and we will direct the questions accordingly during the Q&A portion. If you are listening by phone and not logged into the web portion, you may also ask questions by emailing me, nmatthews@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the NDI website at the URL you see below. If you experience any technical difficulties during the webinar, please use the chat box to send a message to me, Nakia Matthews, or email me at nmatthews@ndi-inc.org.
Great. Thank you, Nakia. And thank you again to everyone for joining us today on our webinar on integrated service delivery. My name is Michael Rausch, and I'm the Manager of Financial Empowerment and Innovation at the National Disability Institute. Today, I am joined by Paula Kelly, Client and Business Management Executive at U.S. Trust, Bank of America Private Wealth Management. She's also the Chair of the Disability Advocacy Network at Bank of America, and she's also a board member of the National Disability Institute. We're also joined by Kate Griffin, who is the Senior Program Manager of Savings and Financial Security at CFED, Carolyn Seward, who is the President and CEO of FWCA Met Center in St. Louis, Missouri, and Krista Brown, who's the Program Specialist at United Way of the Bay Area in San Francisco. Before we get started with the webinar, for those of you who are new to the National Disability Institute, I would like to share with you information on our organization. The National Disability Institute is a national nonprofit organization dedicated to building a better economic future for Americans with disabilities. We are the first national organization committed exclusively to championing economic empowerment, asset development, and financial stability for all persons across the full spectrum of disabilities. National Disability Institute affects change through public education, training, technical assistance, and policy development to help the 1 in 3 Americans with disabilities living in poverty take steps towards brighter financial futures. To learn more about the National Disability Institute, go to www.realeconomicimpact.org. Today's webinar is part of a 3-part series that we are doing with support from Bank of America. Our first webinar was introducing us to financial capability and key concepts and strategies surrounding financial capability. Our second webinar introduced us to behavior economics. What is it, and what is the impact of behavior economics? Today, our guest will help us understand integrated service delivery. How do we put various tools in place in the programs that we have operating? Please note that today's webinar is not disability specific, as we are exploring this topic together, and then we'll be pondering how we can integrate financial services and asset development strategies into our programs that support persons with disabilities to advance their economic self-sufficiency. Our objectives for the day are to define integrated service delivery, learn how to integrate financial services and asset development strategies to assist individuals with disabilities. Also, we're going to identify the spectrum of options to integrate services, and we're going to provide best practices from 2 organizations that have effectively integrated financial services into their program. I would like to thank our sponsors of today's webinar, Bank of America, for their support of expanding the financial capability of persons with disabilities. I'd also like to thank Walmart for their support of this webinar, as well as their support of the MyFreeTaxes.com project. So at this time, I would like to turn it over to Paula Kelly, who is with Bank of America. Paula, I'm going to turn it over to you.
Thank you, Michael. I'm very pleased to be here again with you and all of our partners here on the phone this afternoon. It's truly a pleasure to join all of you, and on behalf of Bank of America, I want to thank all of you for the great work that you do in our communities and the partnership you have with all of us. Bank of America has been a longtime supporter of the National Disability, over 9 years at this point. And through our support over the years, we've assisted over 1.5 million taxpayers with disabilities receive more than $1.5 billion in tax refunds. And we've always advocated for building inclusive communities of practice with our partnership with NDI and the IRS and all of you to have over 100 tax asset building coalitions across the country. And we've educated together over 1,600 people in 2012 alone on economic empowerment strategies for people with disabilities. This year, we at Bank of America are especially proud to partner with NDI and advertise on our Times Square billboard in Manhattan the partnership that we've got with NDI. And if you go on to the NDI website that Michael just mentioned, you'll see a picture of the billboard highlighting that partnership and all that NDI and all of you do for our community. So it's truly recognition that we all do better when we're all connected. Today I'll take a minute just to talk about Bank of America's Disability Advocacy Network. We have over 11 employee resource groups at the bank, of which the Disability Advocacy Network, or DAN, is one of them. And DAN was created to bring together our employees who are impacted by disabilities in some way, either personally or through a family member, friend, colleague, or even a customer or client, or someone, an employee who is interested in learning more about disabilities. And what we do, we have over a dozen chapters nationwide. We provide awareness, seminars, education, and we are a source of support for our employees, as well as partnering with the rest of Bank of America employees to volunteer in the community to make a difference in our communities. Again, we were established to foster a work environment that accepts, values, respects, and supports employees affected by disabilities. But truly, that is the mission of all of the employee networks, to build a diverse and inclusive work environment for Bank of America. Going to the next slide, talking a bit about our collaboration between the Disability Advocacy Network teams and NDI this year. We've got a special relationship and program that we've developed, and Michael Rausch and Katie have been critical in helping us drive this out this year. And particularly for all of you on the phone, this is another opportunity for us to partner together to build financial empowerment. We have two particular programs that the DAN members and NDI are working on this year. The first is financial education training, and the second is disability awareness training for VITA volunteers, tax and asset building coalitions, debt management partners, IDA, and financial education providers as well. Our chapters are located in major metropolitan cities across the country: Atlanta, Phoenix, Boston, Charlotte, Chicago, Dallas, in Delaware, in Jacksonville, Florida, in Maine, New York City. We've got a team in Northern California, and we've got a team in Southern California. So if you are interested in joining us with these, with the work that we're doing on these two programs this year, on the slide in front of you, you'll see Michael's contact information, and you can indicate to him your preference to work with us on financial education and or disability awareness training. We always welcome our partnerships with our community members and would look forward and value a partnership with you to make a difference this year as well. So, Michael, I'll turn it back over to you.
Great. Thank you, Paula, for sharing this information with us today. So now, next up will be our next presenter will be Kate Griffin, who's the Senior Program Manager of Savings and Financial Stability at CFED. CFED is a longtime partner of Bank of America and the National Disability Institutes. CFED is a national nonprofit that empowers low and moderate income households to build and preserve assets by advancing policies and programs that help them achieve the American dream. Kate will be sharing information with us on what is integrated service delivery and will be providing us with an overview. So now I'm going to turn it over to Kate. And Kate, thank you for joining us today.
Thank you, Michael, for that kind introduction, and thank you for inviting us to be a part of this very important conversation. Here at CFED, Here at CFED, undergirding all of our work is the fundamental belief that assets matter to every household that each of us is working with. They matter from an economic standpoint, of course, but also socially and psychologically. No matter how much we can work on helping an individual to build income, and it is a necessary component, it's alone insufficient for really building both financial stability and financial mobility. Assets can affect us in a number of ways. Certainly having assets means that you have a financial buffer to weather emergencies, when there's a health crisis in the family, when the car breaks down, or any number of things that can happen that affects your ability to participate economically. Assets also promote long-term thinking and planning, and research also shows that it enhances the well-being and the life chances of children. Certainly they increase the likelihood of going to and succeeding in college. And even in the home, having an asset base is linked to reduced marital dissolution and domestic violence. But I bring all of this up really because what this shows is that assets matter in a range of contexts. So different social service providers, whether they're working on helping kids succeed in their education and go on to college, whether they're helping people to get and retain jobs, whether you're working on issues of domestic violence, there are elements of what you're doing where the financial management of that individual and that household and their ability to accumulate assets will ultimately affect the work that you are trying to do. At CFED, the way that we think about household financial security, we have this framework that we use that looks at what it really takes, all of the different inputs that it takes to build financial security and opportunity over time. And I apologize to those of you for whom this is old information, if you'll bear with me a little bit. But first is an ability to really both learn financial skills and other kind of educational aspects that help to build your own human capital. There's an element of financial security that is, of course, about earning, either through income or public benefits or some combination of the two. Saving for both emergencies and for the future is a critical element to household financial security. And then the ability to invest in assets that will help you to generate wealth and income is sort of the last piece of that puzzle. Undergirding all of that is how you can protect those emerging income and asset gains, either through financial service products such as insurance, but also through how you can avoid predatory practices such as high-cost payday loans that would ultimately erode your income and asset base. And that's nice as a theoretical framework, but what does that actually mean in practice? And what does that mean in terms of how do we integrate these practices into the work that we're doing? So I've taken that learn, earn, save, invest, and protect framework and laid out for you here some examples of different strategies within each of those categories. So certainly in that learn category, is where you would find everything from your kind of more traditional classroom-based financial education work to more in-depth and intensive financial counseling. Credit counseling and debt management can also fall under this bucket, as well as things that you would do that are more specific to the gaining of an asset, so from an educational standpoint. So for example, if you're working with a first-time home buyer, what additional education do you provide them to navigate that home buying landscape and choose the right mortgage product, for example? In the earn bucket, in addition to sort of workforce development strategies, is where we would also put things like free tax preparation, access to tax credits, as well as assisting eligible families to access the benefits that they are eligible for. Under saving, we certainly look broadly at the spectrum of financial services and ensuring that people have access to appropriate financial services that are also affordable. And there we also look at products that come with savings incentives, matched savings products such as individual development accounts or children's savings accounts, and the removal of disincentives that would affect someone's willingness to save. So for example, asset limits that say that once a family has saved $2,000 in their bank account, that they're no longer eligible to receive a SNAP or a TANF benefit certainly is a disincentive to that family to want to begin saving towards their future. In the invest bucket, we can use those. It's using those match savings programs to then invest in an asset or an education. Other ways that we can help families to own homes, invest in small businesses, and get the education that they would need to further their jobs. And in protect is where we find certainly insurance products, but also things that help around foreclosure prevention and the consumer financial protection work that has been growing over the last few years. So with that grounding in terms of what we're really talking about when it comes to financial services and asset building strategies, we believe that sort of regardless of what kind of community service provider you are, these strategies ultimately can help your client in some way alleviate a barrier that they're facing. If you're doing workforce development work and someone's poor credit score is affecting their ability to get a job, how would you integrate some aspect of credit counseling into your work to alleviate that barrier, as an example? So what we're going to talk about today, and what I've prepared, is some models for how we think about integrating these asset building strategies, and some examples of how people have applied those. And I want to acknowledge that a lot of the examples and the frameworks that we've built today have actually been the result of a Bank of America funded project that we just concluded that allowed us to work quite closely with 5 really innovative social service organizations from across the country that were all working on some aspect of integrating one or more of these strategies into their work. And so we really enjoyed our partnership with Bank of America on that piece. So what does this integration thing really look like? Here are some examples of what this could mean to hopefully help bring this to life for you. So as I mentioned before, how would a workforce development agency provide access to credit counseling services to their clients? Certainly for domestic violence programs, helping the survivors that they're working with to get banked and ultimately gain financial independence is another example of sort of 1 or 2 strategies that are certainly very key to a specific population. Another sort of more robust example or that involves more of these asset building strategies could be that a Head Start site that is located within a community action agency would offer financial education to the children and parents involved with the Head Start program. They may link those parents to a VITA site that's also being hosted at the agency. And then also link their parents to an IDA program as it's appropriate. So it's employing a range of different strategies, but through that initial lens of entering through the Head Start strategy, through the Head Start program. And then finally, and one with which we'll spend a lot more time talking today is looking at, there are examples where a number of local organizations, each of which are specializing in one or more of these asset building strategies, have joined together to offer multiple services, offer access to this entire range of services in a single location, making it much easier for the client to access a range of these pieces in one place. But all of this are interesting examples, but applying this to your own situation, you actually have a number of different options in terms of ways that people have done this for themselves. And we have sort of defined this as 3 different implementation models. And I want to stress that these are options for any single asset building service that you might want to provide. In fact, you could do some combination of all 3 of these things, depending on what the service is and what's appropriate for your clients. And I'll be wrapping up today with some questions, key considerations that you could ask yourself as an organization to help determine which one of these models would be appropriate for your work. So the first model has to do with referring clients to other organizations. So here what we mean is that once you have identified an asset building strategy that is important to your clients that you're not currently able to provide yourself, it's mapping out where in your community clients could access that service, and then in your normal course of business with your clients, giving them a referral to access that service in another site. Certainly it's not a very resource-intensive way to go and relies on the capacity of other organizations. But some key considerations in thinking about referral models is that what you're asking your client to do is sort of leave your sphere of influence and actually go and travel to another location and enter another service provider's world. Which may, in some respects, limit the take-up of services. It's why it's really critically important in thinking about establishing a referral network to think through what's really appropriate for your clients. So in mapping what service providers are available in your community, you may find that, for example, an organization that we worked with in Central Texas, particularly in Austin, Texas, they were located in the southern part of the city, and they found a number of local service providers that were offering the services they wanted to offer to their clients, but they were all in the northern part of the city, and there weren't even adequate public transportation routes for their clients to get to those places. And so even although a sort of cursory community mapping would have led them to do a referral service, it ultimately wasn't appropriate for their clients. They wouldn't have had the outcome that they wanted to achieve. So that's an example of how we have to think through very practically ways in which referral networks can be successful or could also meet some roadblocks. One example of a really robust referral network that I want to talk about is happening in the Seattle area. There's an organization called the Seattle King County Asset Building Collaborative. Certainly the entire city of Seattle has a deep focus on financial empowerment. They are a city for financial empowerment. They were one of the first sites to launch a Bank On project. And really coming out of that, there was a financial education committee as part of the Bank On initial work that piloted what would eventually become known as the Financial Education Partners Network. At the same time as this Bank On movement was happening, the Seattle King County Asset Building Collaborative was organizing itself and sort of established itself with some three main goals. One was to increase access to financial empowerment services, including but not exclusively financial education. Second was to help agencies increase the quality of services that they offer by connecting to one another. And third was through participation in statewide and national coalition efforts, they would focus on making broader systemic change. And so in 2008, they formed this Financial Education Partners Network, which is over 20 different financial education organizations in their community that have committed to providing free and high-quality financial education to the community. The network makes the delivery of financial education more efficient and effective by reducing a duplication of efforts among those community partners, sharing resources and best practices among them, and creating a quality of standard that allows both community organizations and financial institutions to confidently make referrals to members of that network. It works. Clients can search for financial education providers on the Bank On website. And it allows them to kind of match up with different providers based on the topics they're looking to get to engage in, looking at geographic location, language, the type of setting, and they also clients can also be referred to financial education providers through the 211 network. So that's one example. The other sort of interesting thing that the Seattle King County Asset Building Collaborative does is it actually produces, and there's a mock-up of it on your screen, a reference guide called Your Money Helpline. You can download it from their website. You will see that it is a massive document. It's bigger than the telephone book of the rural Ohio town I grew up in. And it provides a wealth of referral information to organizations touching the full spectrum of asset building services in their community. And so it really helps to create not only a robust referral network, but through the work of the collaborative, it's also working to improve everyone's capacity to deliver services and effectively refer out. The second model that I want to talk about has to do with partnering with other organizations. And I feel like this is sort of moving the dial one step further than referrals. So with partnering, I think the key difference here is when you want to have a feedback loop, when you don't want to just send your client out to receive a service, but you want them to actually receive that service and come back to you for ongoing services, or you want to find out what happened to that, then you would engage in a more formal partnership. So that can involve simply kind of shared MOUs and sharing of information between service providers in different locations. Or it can involve this much more involved method of co-locating, where multiple organizations would be hosted at one site in sort of a one-stop setting. You can even go that one further, and I believe Krista will be talking about this later today, and not only co-locate but co-brand what you're doing, and have a very centralized intake process and centralized outcomes that everyone is working towards. certainly the evidence has shown that these types of in-depth, one-stop, co-located services have a really robust impact on the clients who walk through the door. And I'm sure that both Carolyn and Krista will talk about their outcomes data. But as it seems evident, these are also very time and resource intensive programs to set up, and may involve some amount of compromise and giving up of some autonomy between the partnerships and the organizations. Nevertheless, it's certainly, I think, a very viable option for people to think about, depending on kind of what your goals are in providing these asset building services to your clients. So just to throw the names out there, sort of three of the most robust examples of these partnership models are with the Centers for Working Families that I'm sure Carolyn will talk about, financial opportunity centers that have been pioneered by LISC and others, and the SparkPoint centers that started in the Bay Area and have grown from there. So I won't spend much more time talking about those specific examples, but because I know that both Carolyn and Krista will be sharing their best practices and examples. The final model is really is when all else fails, do it yourself, right? So deciding to really build your own internal capacity to embed these services into what you're doing is certainly a viable option for some people. It ensures that what you're doing contributes directly to your organizational mission, and that you're not losing clients in the process, that it's sort of seamlessly integrated into what other services you're already providing. But it is, an option that requires resources and training of your staff. We've seen people pick this up in ways that are about sort of one single service. Some of the organizations that we've worked with, Solid Ground in Seattle, El Buen Samaritano in Central, that's the organization in Austin, have really embraced building an internal capacity for financial coaching and bringing those financial education classes in-house, feeling that was a much better way for them to touch their clients initially. And you'll see a picture here of Coach Judy, who works as the financial fitness coach. Great name, I think, at Solid Ground out in Seattle. And so for those organizations, it made a lot more sense for them to integrate that financial coaching and financial education component of it into their work, rather than refer out for that piece of it. They still do referrals out for other types of asset building services. We found that there are a number of steps to go through to really ensure that whatever way you choose to integrate programs can be successful. I will touch on these very quickly because I know we want to hear from others today. But first is to really kind of understand who you need to get the buy-in from, whether it's this is sort of how every project starts, but certainly whether it's at the level of your board, your funders, but also not forgetting at the level of your frontline staff. Who are your champions for doing asset building services? And as the next step, how do you really ensure that those services are aligned with your program goals? So as an organization, you have a mission, you have a set of strategic goals that you are trying to achieve, and embedding asset building strategies should not be seen as something that is separate or outside of those, but rather as something that is contributing directly to those program goals. Being able to articulate that clearly will certainly help in terms of how you are able to find and cultivate your champions. These asset building services need to be tailored to the populations that we're working with. Certainly, for example, offering individual development accounts, IDAs, are certainly not an appropriate asset building strategy for every family. But thinking about what are the steps around getting banked, starting to set a budget and keeping to it, and finding ways to save a little bit of money every month, those are steps that you can take and think through how to do that appropriately with your clients. Once you've kind of figured out what ways you need to tailor those services for your clients, then it's I think the right opportunity to look within your community at what the local resources are and how you can leverage those effectively in building out your choices for whether you're going to refer, partner with someone, or do it all yourself. And once you've kind of made some decisions about that programmatic design model, then the last step is building capacity of both your staff internally to act on that program design model, as well as any partners that you choose to work with. Certainly there's often a capacity building piece in working with partners in terms of helping them to understand how best to work with your clients. Finally, and you can spend some time with this if you're interested later, we've built out a little bit of a decision tree that helps to look and understand what model might be appropriate for you between this refer, partner, DIY piece, and it considers really whether people are already doing this in the community, how appropriate those services are for the population that you're working with, and ultimately how embedded you need that service to be in your in the course of your interaction with your clients, whether you can sort of easily refer them out or whether you need them to be kind of coming back to you in terms of feedback loops. So this is a model that you can refer to later if it's helpful in terms of thinking through how to integrate asset building services for yourself. So with that, I'll leave it there and turn it back to you, Michael.
Great. Thank you, Kate, and thank you for this great information. And at the end, we will have time for questions, and several questions have come in for you, so we'll hold those at the end. On the slide right now, it has Kate's contact information that you can reach out to her. So again, thank you so much, Kate, for sharing information with us. So our next presenter is Carolyn Seward, who is the President and CEO of the Family and Workforce Centers of America and the Metropolitan Education and Training Center in St. Louis, Missouri. I heard Carolyn speak last year, I believe, at the CFED conference on her program and was inspired by the information she shared, and we're thankful that she is joining us today to share information with us on the work they are doing to integrate various services into the programs that they offer. So with that, Carolyn, I'm going to turn it over to you.
Thank you. Thank you very much, Michael, and thank you to Bank of America for giving us the opportunity to share the work that we are doing here at the Met Center. I'd like to just go back and talk a little of the history of why we are where we are today. A number of people that was in leadership position years ago said that the family is the single most important entity that reflects the conditions of our communities. And if that is so, then we must build programs that inspire and help to stabilize families. We believe that the best way that we could help to stabilize families and touch a number of families with various supportive services was with workforce. And so what we began to do at the Met Center is to determine what would be the overall mission of the center, who the players would be, and what would be the ultimate outcomes that we would be able to share with funders, with stakeholders in our community. So the Met Center is a strategic partnership created to stimulate the economic self-sufficiency of individuals living in low-income communities in the St. Louis region. And the center seeks to accomplish this mission by delivering focused, comprehensive, and accessible job training, placement, and assessment services to the individuals walking through our doors. We serve the underemployed, the unemployed, and displaced workers, leading to sustainable work and a competitive regional economy. Now, the Met Center is centrally located near the Metrolink in St. Louis. We offer comprehensive skill-based training, focused individual employment planning, accessible career development and placement services, and personal financial education and transportation services. One of the things that we were looking at was what would the organizational chart, and we're looking to move the slide one more. Okay. One of the things that we were looking at is what would the Met Center organizational chart look like? We are located in a county facility, a 6-story facility. We have the St. Louis Community College as a partner, Special School District, St. Louis County Government Public Works. And so I thought it was important that that I shared with you how we organize the center to ensure that there was governance and that the day-to-day programs from all of the partners would be managed and supervised. So the Met Board consists of players, all of the major players. So the chancellor from the community college, the president of the special school district, senior policy advisors from St. Louis County, the 2 largest WIB boards, St. Louis City and St. Louis County executive directors, are all a part of the Met Board of Directors. We also have a director for the facility itself, and then we have St. Louis Community College that helps to oversee the skill-based programs. And here's just a quick, again, recap of the partners that we have. So as we began to look at our partnerships and we began to look at this entire integrated service delivery approach, when you have the St. Louis County government, you have your county WIBs, you have the Economic Council, it was very important that as we build the skill-based programs that there were jobs for individuals at the end of the day, and that we would be able to integrate financial education and other supportive services within those skill-based programs. And we asked the permission of the funders from TANF to WIB to dislocated workers, would we be able to integrate within the workforce programs financial education and asset building services? And could we also add those skill sets to the employees that we would be hiring, career specialists, case managers, as part of their job as individuals are coming back to the center, that they would have an opportunity to do financial coaching? And the answer was yes. So what I wanted to show you was one flow of service chart that captures what we do when customers walk into the Met Center. Under services, we do a complete recruiting and orientation, and we discovered that the community-based organizations was better at the recruitment process. We have a centralized eligibility for financial assistance and client services process for ITAs or Pell Grants. We have a centralized program enrollment, and this is where we began to determine who will be a part of our Centers for Working Families. And we determined that we wanted to look at how many times, depending on the program, would we be able to touch the customers walking through our doors. And so with that, we looked at our workforce services for TANF, and we looked at our workforce services for WIA, adult, and dislocated workers. And within that, we began to look at where did we have the opportunity to touch them monthly, and there we saw in our job readiness training, those 3 to 4 week training programs, that we would be able to build within the curriculum financial education and asset development. So we have 2 dedicated staff that go into job readiness training classes every month and deliver a 12-hour curriculum. We also have a financial institution co-located here at the Met Center, the St. Louis Community Credit Union. They also have a dedicated staff person to come in once a month to talk to the JRT classes about financial education and products and services. In addition to that partnership, they have been able to, when there are job openings, we have an opportunity to present job candidates to them to get to get training to become a teller and to become an employee of the credit union. From there, we began to look at what educational programs do we offer, and how do we bundle and sequence services. So through work readiness training, individuals can go to skill-based programs, or they can go to 2-year and 4-year college institutions with the ultimate goal of placement and retention. So our candidates, our customers, prior to getting that job, are receiving the financial education and asset development services, so they are prepared to begin to develop those budgets and know how to manage their money more effectively. Once they come out of the programs, we then follow up on a monthly basis through the career specialist, as long as they are within our program, which is 2 years retention that we follow up with them. And so this has been very, very successful for us. And every step of the process that you see here, we are able to measure what we're doing every step of the way, from the skill-based programs to the placement and retention services and the supportive services that we offer. Lastly, this is our Centers for Working Families process flow. And so what I wanted to show is, again, through the flow of services, which are the majority of the individuals flowing through this process, our CWF, our TANF, and WIA adult customers. And again, we capture the information or the data every step of the way, and this is the performance measures show what we're able to capture here at the Met Center. I also wanted to talk about the effectiveness of bundling and sequencing of services. When we began to look at the whole integrated service delivery model, we determined through our partnerships that it wasn't necessary for every partner to have someone recruiting individuals for their programs and individuals that were doing placement and retention services. We looked at the partners that were best and more effective at doing those particular activities. And so what we did, we found that bundling then leads to long-term engagement. We are open from 7 in the morning until the evening. Bundling increased participants' contact frequency with us because we are talking to the TANF customers every month. It has helped us be better partners and to utilize our resources better, so that every program doesn't have a recruiter. Like I said, every program doesn't have a placement and retention specialist. We have also been able to increase our customer retention in job placement, and we've been able to increase participants' wages. Some of our accomplishments to date: since 2006, we have served over 17,000 customers in employment and training services at the Met Center. Following is a breakdown of the numbers for assessments completed, skill training, job search. In 2012, our estimated economic impact for those that were employed was $31.9 million to the region. We partnered with the St. Louis Community Credit Union to implement behavioral economics and offer financial products to participants. Again, we increased participants' wages. The strategic partnership reduced the total cost of the staff that we had here at the Met Center because it was unnecessary, again, to have recruiters for all of the partners in the program. And we utilized one centralized database where all of the partners have access to the data that we are collecting. And we also completed a publication, a bottom-up definition of self-sufficiency with St. Louis University here in St. Louis. We decided to ask the TANF customers, what does self-sufficiency mean to them? And financial education, employment were critical items that they brought up in the survey and the focus groups that we had. The challenges, managing data integration from multiple data sources. Anytime you have workforce contracts, you're going to have to do double data entry. We want to expand financial education to all of the programs here at the Med Center. Sometimes when we get into the skill-based programs, I just want to mention it that we want to make sure that their curriculums they will be able to handle, 10 hours or 12 hours of additional curriculum time, and that can be a problem sometimes. We're also looking at building out the 5th floor. It is scheduled for completion in the fall of 2013 because we are at capacity. We have no more space, no more classrooms, which is a good thing, and the St. Louis County Economic Council has been a champion in getting additional dollars from the Department of Commerce, EDA, in order to help us build out the center. And we're also researching resources to enhance banking products and services offered. And that concludes my presentation.
Great. Thank you, Carolyn, for sharing this information and your best practice with us today. We really appreciate it, and we will have time for questions. I just want to remind everyone that when you signed up for the webinar today, if you notice that today's webinar is going past the 4 o'clock, that it will be going on past 4 o'clock. And on your registration, it had that on there. And so we still will have time for questions and answers. Our next best practice, we are going to hear from Krista Brown, who is the program specialist at the United Way of the Bay Area in San Francisco, and she's going to share information with us on the Spark Point Centers. The Spark Point Centers are something that the National Disability Institute has been following since the beginning, and we've worked very closely with Krista's colleagues through the Earn It, Keep It, Save It campaign, and really looking at how to incorporate or increase outreach to the disability community. So we're really excited to be able to have Krista present today and share information on the Spark Point Center. So Krista, we'll turn it over to you.
Thanks, Michael. And I wanted to start by really thanking National Disability Institute and Bank of America for hosting this conversation today. It's an important conversation to have in a time of really soaring demand and increasingly limited resources. So we're hearing a lot more about service integration as that goes on. So to provide a little bit of context, back in 2008, United Way of the Bay Area did a study to look at poverty in our community, and what we found was striking. We saw that 1 in 5 Bay Area families couldn't make ends meet using the self-sufficiency standard, which measures the cost of living prices to really meet basic needs. And when you looked at minority communities, it was even more appalling. 2 in 5 Latino and African American families could not make ends meet using the self-sufficiency standard. And this was just steps away from some of the richest communities in the country. And we knew this was affecting other issue areas as well, like health and education.
Krista, I'm sorry, this is Michael. Do you mind speaking up a little bit louder or turning the volume
absolutely.
up? Yeah, so we have some attendees that are unable to hear. So if you could speak up, that would be great.
Great. Is this better?
Yeah, a little bit louder.
Okay, great.
Okay, perfect. Thank you.
Sure, absolutely. And so looking at poverty rates among people with disabilities in the Bay Area, we found that poverty rates among people with disabilities was more than double that of those without disabilities. And we found that in many cases, these people were also employed. It wasn't always an unemployment issue, but that it oftentimes required at least 3 full-time jobs to reach self-sufficiency at the minimum wage level. So United Way had been investing in anti-poverty programs for years, but we were often seeing the same families cycle back through the programs generation after generation because a crisis had knocked them back down below the poverty level. And it resulted in really a cascade effect. And so something, like Kate mentioned earlier, like a $1,000 hospital bill would result in a cascade bringing people back down, where maybe they would pay a few bills late or max out a credit card, which would result in people paying more late fees, being short on rent, or dropping their credit score so they couldn't access a loan to buy a new car. And we saw that these shorter term, especially asset-based problems, would have really drastic results on a family and coming back through our program. And so we knew we wanted to create a program that had a comprehensive approach to all of these issues, but we didn't want to duplicate services that other nonprofits were already experts in. We know that poverty is complex and it requires a comprehensive solution, and we know that people have multiple challenges. There isn't a single bullet to overcome poverty. And we know that finding and accessing all of these services that you need can be a full-time job, to go from place to place, to fill out intake form to intake form. So we introduced in 2009 the concept of SparkPoint. And SparkPoint centers provide financial coaching and a range of other services for low-income families to reach self-sufficiency. So this is really the partnership model that Kate was referring to earlier. And each center brings together a group of partners with local content, expertise, and relationships to integrate their services. And the partners jointly decide on the budget, the services that will be provided, the staffing, and they govern it collaboratively. And for the client, this means only one intake form. They're only entered in one database, and they every SparkPoint center depending on the partners that are at the table. But some examples include integrating financial services with each other, like credit and employment, or micro-enterprise and budgeting workshops, but along with more non-traditional services like child care and nutrition classes from more of our Family Resource Center perspectives. And what we've seen so far is that it helps build a solid foundation, so the cascade effect we saw before does not happen again. So rather than providing your one service, graduating the client or the customer from the program and hoping it works, you're able to provide layer and layer of support to make sure that we're building the blocks of the foundation to make sure that cascade doesn't happen again. So we work with clients for 2 to 3 years, and we make sure that all of the partners at the table are committed to working in a client-centered coaching approach. And part of that is because we know that the client will need to come back long-term for multiple services to be successful. One of the tenets of the SparkPoint model is encouraging the client to bundle or to take up different services from multiple providers, because we know that this builds the foundation that we referenced earlier and increases the likelihood of success. And because this is a model, not a program, it's flexible enough to work with a wide range of communities. So all of our SparkPoint centers look and feel a little bit different depending on where they're located. But some of it's flexible depending on the community that you're working with. In terms of working with people with disabilities, we've found that it's been really important that we are customer-centered. So all of our staff, regardless of the partner organization that they come from, are trained using a strengths-based coaching approach. And they have an integrated case management system, which is really effective because this allows all of the case managers or the coaches who are working with the customer to know the similar information so the client isn't repeating story after story and having to update all of the different service providers about the work that they're doing with each other. And in terms of the relevant services, we've really seen a range of services that people with disabilities have taken up over time. But some particular ones to point out include benefits advocacy and legal services for those who have had their benefits terminated, reduced, or need help navigating the process, and credit and debt negotiation for both clients and their family members, as many people have had to take out significant debt to pay off medical bills. And employment and microenterprise. Using the strengths-based coaching approach, we've found ways to be creative with many of our clients and different ways to earn income, understanding that a 9-to-5 job is just one of the many options. So ultimately, every SparkPoint center is working with their clients to reach financial stability. Depending on the community needs, the services provided to get there might look and feel different, but every SparkPoint Center provides services to reach a livable income, a good credit score, enough savings to prevent that cascade that we mentioned earlier, and a manageable debt-to-income ratio. And all of the partners at the table help measure progress along the way every 90 days and are committed to these same principles and the branding around the SparkPoint model. So just to briefly talk about the outcomes so far, right now we know that bundling or taking up multiple services greatly increases the chances of success, in some cases 2 to 3 times. Overall, 65% of our measurable clients are making at least a 5% positive change in increasing their income, increasing their savings, increasing a credit score, or decreasing their debt. And we know that those who take up multiple services are 2 to 3 times as likely to achieve an outcome, a clear indicator for us that the integration of services is important to continue. So right now we have 10 centers around the Bay Area with satellite sites popping up around the nation. Each site is hosted at a different type of institution. So our San Mateo SparkPoint Center is hosted at a community college. Our Solano locations are at an elementary and a middle school. And one of our Contra Costa sites is co-located with county services. Each site looks and feels slightly different depending on the community needs and the services that are provided. But for those of you that are interested in doing something similar, I'd really encourage you to reference the chart that Kate presented earlier, and looking at who in your community would be interested in doing something like this, who is already doing something like this. I know in terms of challenges, it takes a lot of time, and you have to make sure there are champions at the table, but we're definitely seeing the results. And with that, I will turn it back over to Michael.
Excellent. Thank you, Krista, for sharing information with us on the Spark Center models. This has been really wonderful information that each of our Prince centers have shared, and we've had several questions that come in. So we have some time now to be able to spend on questions because we are going until 4:15 today. So if you have any questions, please feel free to enter them in the Q&A box, and we will field the questions to the various presenters. So what I'm going to do now is I'm going to go through some of the questions, and then each of our presenters can address them. So the first question that comes in is, who funds the one-stop locations, the co-located centers? Does each agency pay a fee? Kate, this came in whenever you were talking about the different models, this particular question. Would you like to address that, and then we can have the other partners answer it as well? So who funds, whenever you have programs that are co-located, does each agency have to pay a fee to be co-located?
I actually think it'd probably be best for Carolyn and Krista to answer that in a real-life situation in terms of funding for their programs.
Okay. So Carolyn or Krista, would you like to, one of you like to offer thoughts on that question?
Yes. This is Carolyn. Each partner fund their own programs, and with the financial education, or depending on the type of supportive service, we include it in our funding requests or the proposals that we submit in our budgets each year. So each of the partners, the St. Louis Community College funds their programs here, special school district, the community-based organizations fund their programs as well.
Great. And Krista, would you like to share some insight on that question?
Sure. Our funding structure looks a little bit different. So United Way provides some portion of the seed funding for the SparkPoint Center, but each partner is expected to contribute something in kind. So that might be some of the services, it might be some of the space. It really depends on the center and the partners at the table. And then all of the partners have a joint governance committee at each center, and they are tasked with fundraising to support the model. So one thing we want to make sure is that this integrated work does not cannibalize their existing funding sources. but that working together in these new ways allows them to apply collaboratively for funding opportunities they wouldn't have been able to before. And so these steering committees have really fundraised as a team and as a collaborative.
Great. All right. And the next question, and I'll just let anyone answer it, but Kate, this question came in also when you were presenting, and it was asked, where can we find sample MOUs for the partnership model? So does CFED have samples in their toolkits, or Carolyn or Krista, do you all have examples of MOUs that can be shared with the audience?
So this is Kate, and what I'll say is no, not yet. We certainly, in doing this work so far, have seen a great need for different types of tools and templates to be available, and as a national intermediary, we want to be responsive to that. So with a number of different projects that we're working on, we're working towards trying to create more of a resource center for folks with those types of things.
Okay.
Yes, we do. This is Carolyn. We have MOUs, depending on if it's supportive services or employment. But yes, I will be happy to share what we have with others.
And
Great.
we also have MOUs that I would be happy to share.
Okay, wonderful. The next question that came in, and we kind of covered this on our first webinar in our series, but it's asked if someone can explain the difference between financial coaching versus financial education. So who would like to explain the difference between the two?
I'd be happy to take a stab. Oh, go for it, Krista.
So I would say financial education in most cases is largely knowledge transfer, and so it's explaining maybe how you do a budget or what a credit score is, and kind of really making sure people understand the content of financial expertise. Coaching is usually a little bit more goal-oriented, and so someone who comes in and they have a savings goal or something else, and it's really a process of helping people identify goals, keeping them accountable to those goals, and really coaching them through that process.
All right, great. Thank you. The next question is, if a disability organization would like to explore this more, looking at integrated service delivery within their community, which community should they start to reach out to? So any advice to disability organizations on who they could reach out to within their community to start the conversation if there is not a spark point or if they don't have a location like Met Center. So thoughts?
Sure, this is Kate. I think that really kind of looking at the range of different asset building services and trying to map out all the different community service providers that could potentially be providing those services within the community is a really healthy first step. And then also thinking through whether that's through conversation with those organizations or first some internal conversation, thinking through kind of what would need to change about how they deliver that service to make it more appropriate for your community. Is really important to kind of be very aware of as you start to engage in that initial conversation. So those would be kind of two first steps I would think through.
All right, great. The other question is there a national TA center for groups to reach out to provide support? So, Kate, I guess we'll direct that to you. I know you all have some toolkits or put out some reports, but if you could just address that would be great.
Sure. So on our website, cfed.org, we do have a number of sort of guides around integrated service delivery. We've one on workforce, one that looks at integration into workforce development, one that looks at homeless prevention services, another that looks at Head Start services. And then we have a couple of really interesting briefs that we wrote as a part of the project with Bank of America and these 5 social service organizations. So doing any sort of search for integrated service delivery on our website should pop those up. We are looking to do some more technical assistance around this work, and we also have a partnership, a contract with the Department of Health and Human Services, where we will be creating a number of resources around asset building integration that will be housed on the ACF website, the acf.hhs.gov. So that's all coming down the pike in the next 6 months. But beyond that, I mean, certainly, particularly for the types of models that Carolyn and Krista represent, there's certainly other places to find technical assistance around Centers for Working Families models and the SparkPoint models, but maybe you two want to address that.
Yes, this is Carolyn. The Centers for Working Families, and I have to say the Annie Casey Foundation has been a major supporter of us in terms of the technical assistance that they have given, the research that has been provided, that they receive throughout the nation, and it has been just invaluable to us. And when we're happy to share, we're happy to host sites. I've had a number of organizations come to the Met Center over the years, and we've really just sat down and mapped out and kind of brainstorm how best in their community they would like the process, the integrated service model, to go. And so we've had the support of the Casey Foundation to help us walk through this process.
Great. All right. So we are coming up on the final, 3 minutes of our webinar, and we have several more questions. So we're gonna do this rather quickly if we can. So I'm going to direct these to one person, and then we'll try to get as many in as we can. So Carolyn, this question is for you. What would you say is the biggest selling point to a workforce center to collaborate with asset development and financial education partners to offer more integrated service delivery?
The greatest impact is that you will be able to reach more customers. Over 7,000 customers come through the Met Center. 10,000 come through the one-stop career centers. We just don't have, at this point, the resources to serve everyone that walks through the door. But can you imagine if we were able to have the necessary financial resources to fund where 17,000 people are getting resources every month, financial education resources, that would have a major impact in our community.
Great. Kate, this one is for you. This came in during your presentation that I missed. But you talked about the removal of disincentives. And so the question is what way do you recommend the removal of disincentives like SNAP?
Sure. So just to clarify, what I meant there was that the removal of disincentives to savings and sometimes asset limits that are placed on some benefit programs like SNAP or TANF will create those disincentives to savings. So in general, that's created at a state or a local level, whether those asset limits exist, and so it's about policy advocacy. Certainly, for those interested in resources around advocating around asset limits, the Assets and Opportunity Network, which you can find at assetsandopportunity.org, has lots of resources to help you with that.
Great. So we're going to take one more, and then we'll have to close it up. Krista, this question is for you. Were your financial coaches trained by a specific organization, or can you recommend a training program for financial coaches based on your experience?
Absolutely. We train all of our financial coaches in-house. So we here at United Way have developed a 2-part financial coaching series. So it's a 2-day training along with learning circles every other month that we engage our SparkPoint staff in. But there are many organizations that provide financial coaching trainings. Other ones include EARN, and there NeighborWorks also provides some financial coaching training as well.
Great. And we will put on our website a handout, an effective strategy handout that identifies various financial coaching programs and the ones that we at the National Disability Institute have looked at, and also look at the programs that have integrated disability awareness into those financial coaching programs. So give me a week and we will be able to put that up on our website. Please feel free to visit our website at realeconomicimpact.org. Please feel free to sign up for our listserv as well, and the information is on your screen. The recording and the PowerPoint for today's webinar will be available on our website as well. I think it usually happens within 24 hours, but Nakia, let me know if I have that information wrong. But definitely by the 1st of next week, it will be on our website. I would like to thank Bank of America again for sponsoring our 3-part webinar series. I'd also like to thank the Walmart Foundation for their support of our work as well, particularly through the MyFreeTaxes.com project. I would like to thank Paula Kelly with Bank of America for participating today. Thank you to Kate at CFED, Kate Griffin at CFED, for sharing information and helping us understand what integrated service delivery means and the spectrum of options. And I thank Carolyn Seward with the Met Center in St. Louis and Krista Brown with United Way of the Bay Area in San Francisco for sharing your best practices with us today. I'd also like to say thank you to my colleagues at the National Disability Institute and to Nakia Matthews for assisting with today's webinar, for their support as well as in the development of the tools highlighted. If you have any questions after this webinar, please feel free to reach out to me at mroush, R-O-U-S-H, at ndi-inc.org, or my contact info, my telephone number is there as well. Please note that we will not have a webinar in July, and our next webinar will be August 14th. Thank you again for participating in today's webinar, and thanks again to each of our presenters. We hope everybody has a great day. Thank you.